Hi, everyone. I'm Michael Chesney.
And I'm Megan McGurman. Welcome to another episode of For the Love of Health, brought to you by ChristianaCare.
Especially due to the pandemic, most of us have had at least one telemedicine interaction, maybe sitting at home talking to a clinician via smartphone app when we have a fever or a sore throat. But virtual interactions can now also be a part of your care when you're actually in the hospital.
And that's been the experience for thousands of ChristianaCare patients recently through virtual acute care nursing. Joining us today to talk about how this program is shaping the future of care delivery are Michelle Collins, Vice President of Nursing Professional Excellence for ChristianaCare, and virtual acute care nurse Melanie Ries.
Michelle and Melanie, thank you so much for being with us today.
Thank you for having us.
Thank you so much for having us.
Before we dive into the details, what is virtual acute care nursing?
So virtual acute care nursing is an opportunity to relieve some clinical documentation burden for clinical nurses who are at the bedside and transition that work to a virtual acute care nurse who can complete the documentation on the same system with greater efficiency and, in fact, with some better attunement when it comes to like patient discharge, because it's a one-to-one experience for the patient with a virtual nurse without any distractors for the virtual nurse, unlike the clinical nurse. So it's really an opportunity for us to help save time for clinical bedside nurses such that they can provide more of the care that's direct hands-on.
And Melanie, you are one of those virtual acute care nurses. You are both at the bedside and really on the iPad. So talk to us about what a typical day looks like for you on both sides.
So I work in a dual role, and some days I work at the hospital on the floor, and some days I work virtually. I always tell the patients that I'm an experienced nurse and I'm another member of your care team. I can communicate with the patient via the iPad in their room. I communicate with members of the care team, participate in interdisciplinary rounds. I prioritize getting patients discharged. I monitor their labs, I monitor the vitals.
Virtual nurses today can complete admissions, med histories, they can complete discharge, they can do patient education at discharge or any time in the in-between on a new medication, the plan of care, the discharge plan. They can provide education to family members in the room or caregivers of the patients. They can engage with any provider, so physicians, pharmacists, respiratory therapists. Anyone that walks into the patient's room can connect with a virtual nurse.
I am a clinical coach to the nurses at the bedside, the ones, that might be more novice. All of our virtual nurses are experienced nurses. They work as preceptors, mentors, they work as charge nurses.
Virtual nurses look at our national early warning system signs to say which patients look like they're experiencing some deterioration early so that they can get involved from the patient quality and safety lens, and also provide the reminders for lines getting taken out. How many days are we at? Or is that meeting protocol? So it's really a very full role that we ask the virtual nurses to play.
And what does that feel like then when you're a bedside nurse and working with another virtual nurse in a patient room?
It's nice because I can worry about the hands-on stuff. I can get the meds. I can get the patient up out of bed. I can get them ambulating sooner because I know that I have another set of eyes, an experienced set of eyes, reading the chart, double-checking the orders, making sure all of those things are done.
Out of curiosity, where are you on a virtual shift comparatively to your actual bedside location?
So we are at a different campus. We are not within the hospital, and we're housed with the other virtual nurses. It's also been neat interacting with nurses from different units that we didn't always, interact with before,
Sure, yeah.
And we're learning from each other.
And Michelle, we know you're looking at the data for all of this. What have the outcomes been like for the patients who are able to work with the virtual acute care nurses?
Patient experience is one of the first early indicators of a significant positive change. In our pilot, for instance, we had one of the units went from 18 of 24 metrics improved over the course of the pilot. The other unit went from 20 to 24 patient experience metrics that we measure as improvements.
Wow.
We also did a separate community insight survey with our patient experience vendor, whereby we were able to gather more specific information from those patients in the pilot areas and what their experience truly was. And almost 80% of our patients said, we like virtual nursing. Two of the most significant outcomes that we have seen improvement in is discussed care at the bedside. So if you think about it, when a virtual nurse is talking with a patient, it's a one-to-one relationship. There's no interruption. There's no call bells going off. You're not worried about hanging blood or a provider waiting to talk with you about the plan of care in another room. Number two was information about symptoms. So as the virtual nurses are doing the discharge education and any education in between, they're using TeachBack as part of our patient experience bundle. In totality, we've also seen a reduction in length of stay, a reduction in our readmission rate, and a reduction in our observed and expected mortality.
You mentioned the pilot program. I know this started roughly about a year ago, right? Walk us through ChristianaCare's journey so far.
Yeah, so we launched September of 2022. Pilot was a total of 49 beds across 2 units, one at the Wilmington campus, one at the Newark campus. And those units were in pilot with us innovating in this care delivery space from September through, I'll say, May of 2023. So during the month of June of 2023, we went from 49 beds to 510 beds. So 41% of our, approximately 41% of our beds are now live with virtual acute care nursing. And so the data that's being tracked now is certainly much more expansive across 17 units, not just the 2 that were in the pilot. So we're using, those data dashboards to really do a deeper dive and look at, where can we still improve upon the care delivery and the standardization of this as a nursing practice model. And how might we leverage virtualization of care, to other disciplines, as well. While we're doing the work of practice standardization right now, we will be planning for an additional 500 beds. And so that planning is underway simultaneously with the standardization in practice, looking at different care environments where we aren't now.
Michelle, for nurses who will be getting this in the future and haven't had experience with it yet, what would you want them to know?
I think it's an opportunity. Let yourself be open. Yes, this is a change, but it is a change that's demonstrating improvement in outcomes, and it is, what's next? Nationally, there's policy development happening around virtual acute care nursing. So while it may feel like you're in the small microcosm, of ChristianaCare right now, this is a national effort to really help continue to elevate nursing and enable us to continue to provide exceptional care to patients with the resources at hand.
Melanie, what would you say to a nurse who hasn't worked with this before, based on the experience you've had and the experience your colleagues have had?
So it's a change. We're doing things differently, but we have to do things differently. There are not enough caregivers. And there won't be, going forward. What is the plan? That's when I was still just working at the bedside a year ago, I was very overwhelmed. We would have these heavy assignments, very sick patients. It was hard as an experienced nurse. What are we going to do? We have to figure out a different way to do things. This is something different.
Melanie, you and your fellow nurses are heavily involved in the process of working through how virtual acute care nursing looks at ChristianaCare, making suggestions, providing change opportunities, not just being handed down from on high, here's how this works, go do it. Is that right?
That's very true. Since the beginning of the pilot, clinical nurses that work at the bedside from these units have been very involved in the creation of the workflows. We literally dissected a day in the life of a nurse and picked out, okay, I could do this virtually, and the clinical nurse can do that at the bedside. We broke it all down and came up with workflows that worked for the nurses, made up by nurses, and we're still involved. This is still, ever changing. We're still adapting. We're still working on the workflows.
This program would not have been as successful as it is now and will continue to be if clinical nurses weren't at the forefront of this change in nursing practice care model. Not about me, without me. They know we're listening. We continue to listen. We continue to engage them in a huddle daily. We're asking for barriers. We're asking what's working, what's not working, what do we stop, start, and continue.
Melanie, what have you seen from doctors, physician assistants, nurse practitioners in terms of their experience with this new way of doing nursing?
There's been a good reaction from providers. Some providers, when they're in the room with the patient, will actually call the virtual nurse, and we can be a part of the conversation about the patient's plan of care. I interact with the providers very often. I touch base with them during interdisciplinary rounds, and then I understand what the patient's discharge plan is. There's instances every day where I see something because I have the time to sit and look at the chart and review the plan of care and then communicate the patient's needs to the provider.
Michelle, as Melanie mentioned, workforce is something that's being discussed nationally. There are clearly not enough nurses. How is virtual acute care nursing helping ChristianaCare address that?
The virtual nursing component enables the nurses both working in the virtual capacity as well as the nurses working at the bedside clinically to function at top of license and really optimize their experience. We want to be able to validate with evidence through feedback from our clinical nurses, from the virtual nurses who are also clinical nurses, from our nurse leaders, that this program has demonstrated not only the patient experience outcomes, but is also doing the work of nurse retention on the units where they are currently functioning or within ChristianaCare. We'll take either. I think that's where the opportunity is. How can we continue to hone this program, to optimize it, to provide the experience that a clinical nurse leaves at the end of the day saying, today I did my role as a nurse. I feel fulfilled today as a nurse.
And Melanie, do you feel fulfilled?
Definitely. It's definitely very rewarding when I work in the virtual space, when I'm able to talk to a patient one-on-one without all the distractions and all the giant to-do list. And then on the other side, when I work in the clinical space, when I'm on the floor, I'm not as physically exhausted. I'm able to bring more energy into that space, and I'm happy to be there.
Michelle, the work you're doing is really aimed at impacting the nursing situation at ChristianaCare, but you're also having an impact at the national level. Can you talk to us about how ChristianaCare's experience is impacting the rest of nursing?
We wrote a proposal to the American Nurses Association over the winter of last year, and I'm exceptionally proud to say we were one of 3 proposals accepted for national presentation to the June American Nurses Association Membership Assembly on this is what virtual nursing is, these are the possibilities with it, these are the outcomes that virtual acute care nursing can drive. They had to vote on whether or not they agreed that this is something that was worthy of national policy development to kind of flush out what are the challenges, issues, barriers related to insurance, licensure, nursing practice, et cetera. So we're very fortunate that we were able to, present live in June to the entire membership assembly and have that idea accepted.
So last question is for both of you. What is the future of virtual acute care nursing?
Beyond our expansion, I think that the ANA will follow through so that we'll see some stronger practice guidelines around this and maybe a little less variation. But I think the future will look like multiple other disciplines also virtualizing. What other disciplines can rapidly deploy and utilize the platform we've already established to say, yes, this works, so that we can deliver care more efficiently, across our community.
And I think as far as the workforce goes, this is an opportunity to work in a different environment. And I think in the future, we might have nurses that were ready to retire, but maybe they stay on in a role like this where we can take advantage of their wisdom, but they don't have to do the physical labor as much anymore. But as far as, virtual healthcare in general, like the sky's the limits. Like there's going to be so much change. I'm happy to be a part of something that, is trying to take best advantage of this technology and take the best care of patients.
Michelle and Melanie, thank you both so much for your time today.
Thank you so much.
And we'll link to a video showing virtual acute care nursing in action in today's show notes at ChristianaCare.org/podcasts.
There you're also going to find quick links to subscribe to For the Love of Health on a variety of podcast apps. And those are also great places to leave us a review and help even more people find the show.
And of course, we love to connect with all of you on ChristianaCare's various social media platforms.
We're going to be back in 2 weeks with another great episode.
Until then, thanks for joining us for the love of health.